Emily Donovan is co-founder of Clean Cape Fear, a grassroots community group that formed in 2017 after learning DuPont Chemours contaminated North Carolina's drinking water supply for over 40 years with toxic PFAS. Emily has testified before Congress twice and helped secure reverse osmosis filling stations at 49 public schools impacted by PFAS contamination in Brunswick and New Hanover counties. Recently, her group filed a complaint with the United Nations seeking redress for human rights violations due to excessive PFAS exposures from Chemours. Emily sits on the planning team for the National PFAS Conference Series and is a leadership team member for the National PFAS Contamination Coalition. And she frequents Washington, D.C. and Raleigh, North Carolina, pressuring lawmakers and regulators for quicker responses to our growing PFAS public health crisis. I'm going to go ahead and turn it over to you, Emily, to start us off.
Well, hi, everyone. Thank you so much for having me here today. I'm going to start by sharing my screen, and we'll start this presentation. So first, I would like to give just a brief overview of PFAS for those that need maybe a quick refresher. Or are learning about the chemicals for the first time. So PFAS stands for per or polyfluoroalkyl substances, or how I like to refer to them as permanently freakish altering stuff. You may have also heard them referred to as forever chemicals because of the carbon-fluorine bond, which is what makes them nearly indestructible and unable to biodegrade naturally. PFAS are human-made chemicals. They're nearly indestructible with currently no proven safe disposal method. Our modern world thrives on their performance characteristics, from heat resistance to stain and water repellency and durability. And until recently, there has been little to no innovation to remove our dependency on these highly toxic chemicals. The CDC estimates that 97% of Americans' blood has detectable levels of PFAS in them. This chemistry is also known to biomagnify up the food chain, meaning when your food supply is contaminated with PFAS, and the PFAS transfers into your body and into your bloodstream. The most important aspect of PFAS for health professionals, though, is that they are endocrine disrupting. The human health trade-off is incredibly alarming. Newer research and science is now revealing, even at very small amounts of exposure, PFAS impact nearly every major system in the body. The bolded health effects have been thoroughly studied with a high certainty factor, and the non-bolded health effects have a lower certainty factor, but enough science to cause alarm and concern from the environmental health community. And anecdotally, when you encounter a knowledgeable patient who is dealing with severe PFAS contamination in their community, like mine, they will tell you that they are seeing high rates of rare or recurrent cancers. In fact, we're seeing it even in younger populations. My community has seen a tremendous amount of well, anyway, sorry, I'll move. I just got a little lost on my speech. I lost a dear friend 2 years ago to a cancer that she should have been able to beat with conventional treatment, but the treatment failed repeatedly. The cancer came back 3 times, and she died before her she died in her late 40s. So this is something that has impacted us personally. I'm sure if you're already living in a PFAS contaminated area, you yourself have your own stories and are seeing your own things. Here's a little background on the contamination story in the Wilmington, North Carolina area and along the Cape Fear River Basin. In June of 2017, we woke up one day to front page headlines stating the same thing DuPont did in Parkersburg, West Virginia with PFOA was the same thing that DuPont, now called Chemours, was doing with PFOA replacement Gen X in southeastern North Carolina. Unfortunately, we would later learn that the situation was much worse than we had originally thought. For those of you who don't know, Parkersburg, West Virginia is ground zero for the discovery of PFAS. The movie Dark Waters stars Mark Ruffalo and chronicles the fight of lawyer Rob Bilott and his decades-long battle to win health studies and a class action lawsuit against DuPont for their chemical cover-up of PFOA. I highly recommend watching this movie as well as the documentary The Devil We Know. When our local newspaper broke the story, we attended protests and rallies, and when public leaders were slow to give us adequate answers, my group, Clean Cape Fear, organized the first ever public forum on Gen X. We brought leading scientists, pediatrician, and community stakeholders to Wilmington to speak openly and honestly to the public about our PFAS contamination crisis. Our municipal tap water was, and it still is in many parts of this region, contaminated with some of the highest levels of PFAS detected in multiple nationwide tap water studies. My children's school had the highest level of PFAS in the EWG study that you see to the left of your screen. And Oak Island and Ocean Isle, located in the lower part of Brunswick County, or coastal part of Brunswick County, have the highest levels of unmonitored PFAS per this NRDC study that was released last year. As Sarah said, Clean Cape Fear is a grassroots community group, meaning we're not a nonprofit or paid advocates. We are all volunteers living in a severely contaminated region. We are focused on education, awareness, coalition building, and making sure our contamination crisis is not overlooked, ignored, or ever repeated anywhere else. We fight to make sure our polluters are held accountable and the solutions provided are proportional to the scope and magnitude of our contamination crisis. And that is why we work with building coalitions with local, state, and federal partners that are willing to focus on these three things: stop all PFAS exposures, know the health risks associated with our exposures, and make the polluters pay. And today we are focusing specifically on knowing the health risks and hoping that we can build a solid coalition with the nurse community to push this forward. Recently, the EPA has begun to regulate a handful of PFAS. Most notably, last year, the EPA proposed first ever drinking water standards for 6 PFAS, 2 of which are no longer in commercial use. This is an important first step that the EPA is taking. However, the EPA also recognizes that there are thousands of PFAS compounds in existence, and regulating 6 is a good step in the right direction. But we do not have the time or resources to regulate PFAS compounds individually, and that is why Clean Cape Fear regularly urges federal and state governments to regulate PFAS as a class. Because some PFAS are known to bioaccumulate in our blood, one of the first questions contaminated community members, especially in my community, asked is how much PFAS was in our blood. Access to PFAS blood testing has vastly improved over the last 6 years, but it was very hard to get testing when we first learned about our contamination crisis. I'll share with you what we have, what I found with my blood level and later in the presentation. But however, I strongly recommend that you take the time to learn if there are any academic health studies happening in your region that has open enrollment. I think this is really important when you are dealing with concerns with patients, to let them know that there is potential open enrollment in an academic study. The benefits of participating in an academic study is that the blood testing is free and often you get paid to participate. The results might be more comprehensive depending on the study design. There are setbacks, though. There's barriers to qualify to the study, and the results may be delayed, making it a little unsatisfying to wait for those results. Commercial blood tests are appropriate for patients who are concerned, or I believe that commercial lab tests are appropriate for patients where they have exposures, but they're not dealing with a unique contamination situation like my community. Commercial results do come immediately. The results are not typically covered by insurance and could be very expensive for most patients. But the good news is that there's clinical guidance available from multiple trusted and reliable sources that can help you navigate the decision-making process in a compassionate and patient-centered way. My family opted to participate in the academic study called the Genetic Exposure Study. We did this because we knew that we were exposed to over 300 different PFAS in our tap water. My situation, obviously, is not always the case for most patients, and I'll explain my blood results and clinical experience in a bit. I'm very sorry that not all the pictures are showing, but what you can see is the results and report back that I received, and I took those to my doctor. To provide a bit of backstory, PFAS-contaminated community groups all across the nation have been pushing to correct the health communications gap related to PFAS. The problem we currently face is the science behind PFAS is accelerating, but the education awareness within the healthcare system is limited. So I'm hoping you'll join us in helping break down these barriers. Nurses are often the first people we see when seeking patient care, and we know the burden often falls on nurses to teach many doctors what to do. Community groups worked hard to get the CDC's ATSDR to order an updated PFAS clinical guidance report from the National Academies of Science. I'm on the leadership team of the National PFAS Contamination Coalition, and we worked closely with NASM on the community liaison aspect of the guidance. This report is a quality body of work, well-informed and centered on overexposed community concerns throughout its pages. However, there are over 250 pages in this document, and few clinicians have the time to read the document from cover to cover. We know many clinicians in PFAS hotspots have developed 2 to 4 page internal reference documents from this report. And if you have that kind of time, we highly recommend doing it. What we valued the most from the NASON report is that the blood testing recommendations and medical monitoring guidance to help inform clinicians' care were very easy to understand and follow. NASM identified 7 PFAS and with enough supporting documentation to help develop blood testing and medical monitoring protocols. So there's a great chart on page 149 of the NASM report that explains follow-up patient care depending on the blood level results. And those blood level results obviously can, if you have under 2 nanograms per milliliter, or if you're the 2 to 20 range, and then if you're in the high risk 20 range, there's different protocols based on what your levels are. I will point out that the report does have caveats, and I don't have time or the expertise to go into those today, but they are well documented in the report. What I will share with you today is my family's blood level results from our academic study. So I took my results to my primary care doctor. We discussed them in detail, and my entire family has blood levels that are above the 2 nanogram per milliliters, which puts us in an elevated risk category for possible health effects. The PFAS in the varying shades of purple are the levels for the NASM's 7 PFAS. The PFAS in orange and red are specific to Chemours, which a commercial lab would not be able to detect. The Chemours PFAS are the major contributors to the exposure in my region, and that's why my family felt it was important to participate in that academic study so that we could see those levels in our body. There's currently no clinical guidance, unfortunately, to inform the Chemours-specific PFAS. And so if we look over at my husband, when we combine his Chemours-specific PFAS levels with his NASM-specific PFAS levels, he does exceed that 20 mark and could potentially be put in a high-risk category. There's little, this is why we are continuing to push for a class-based approach so that patients like my husband can have confidence when they speak with their clinicians about what course of action should occur with the next with this information. As you can see, they look at if you're in the 20 or above category, increased thyroid monitoring, kidney and testicular cancer monitoring, ulcerative colitis. Those types of areas become important. I do want to address that we do have some concerns with ATSDR's most recent announcement where they updated their PFAS clinical guidance. While it's vastly improved from the outdated document that was created in 2019, we feel that it does fall short. The ATSDR did not engage with contaminated community groups to help inform its updated guidance like NASM did. The guidance also minimize the benefits of patients seeking blood testing. And I find it very helpful to have my blood testing, and many other contaminated community groups feel the same way. It creates a baseline of exposure and a snapshot of where my levels are so that I can periodically see if by reducing certain exposures and making certain lifestyle changes that I'm seeing these levels drop over time. It also empowers me to have autonomy over the best possible decisions related to my own health choices. The ATSDR guidance also does not elevate the NASM medical monitoring guidance in any meaningful way. And so that's why we're endorsing these 3 clinical guidance. The PFAS Exchange is an online resource that is supported with funding by NIHS. North Carolina's Department of Health and Human Services has a 2-page clinical guidance that we feel adequately explains and synthesizes the NASM report. And then if you have time and want to pour through the NASM report, it's available for free online electronically, and you can gather information to better inform yourself depending on the situation within your own community. And I'll stop there.
Thank you so much, Emily, for your valuable experiences. We're going ahead to go ahead and move to Stephanie Schweikert. Stephanie is an environmental health campaigns manager at North Carolina Conservation Network, and Stephanie leads the organization's environmental health work, including work to protect families and communities from forever chemical pollution. Prior to joining North Carolina Conservation Network, Stephanie worked as outreach coordinator for Sound Rivers and served a term with AmeriCorps. She currently serves on the board of the Cecilia Rawlins Fund, and in her free time, she enjoys camping and exploring North Carolina with her family. Stephanie has been with the North Carolina Conservation Network since 2011. Stephanie, I'm turning it over to you.
Thank you, Sarah. Hello, everyone. Thank you so much for being on today. So North Carolina Conservation Network, we are a network of more than 60 environmental and environmental justice focused organizations. We work together to protect North Carolina's environment and public health. We work to engage diverse organizations and people in environmental policy decision making at all levels of government. Today, I'm going to spend my time discussing a little bit of what's happening with forever chemicals at the state and federal levels and how health professionals can get involved. So I will start with the North Carolina General Assembly, also known as the state legislature. The state legislature is made up of two bodies, the Senate with 50 members and the House with 120. All state legislators serve 2-year terms, which means this fall we'll have elections for every North Carolina state, House, and Senate seat. Republicans hold a veto-proof majority in both of these bodies. This year, we're in what's called a short legislative session. That means that we'll start the legislative session later in the spring, and we expect it to last a few months. We'll start this year's short session on April 24th and would expect the legislature to adjourn sometime in the summer. Then they'll all go back to their home districts and get very busy with the campaign season. The state legislature has consistently introduced good bipartisan legislation on PFAS. However, we've had a challenge in getting that good legislation over the finish line and passed as law. In 2023, we did see a little bit of progress, particularly around PFAS and firefighting foam. Emily discussed how widespread PFAS impacts are in North Carolina. One of the things we haven't covered yet is firefighter impacts. Firefighter turnout gear and many foams, firefighting foams, contain high levels of PFAS chemicals. Firefighters also experience higher levels of cancer than the general population, as well as a higher risk of dying from cancer. Last year, legislators included funding in the state budget to create the first firefighting foam buyback program in North Carolina. What this program does is provides funding for stations to get rid of their PFAS containing foams and replace it with safer, newer foams that don't contain PFAS. We think this is a really good start. We don't think that local fire stations should be liable for holding PFAS foams, but it's just a start, and we need to see more action around this. The legislature also funded health studies for firefighters as well as people living in highly impacted areas last year. For 2024 and beyond, the state still has a lot of loose ends in action that the legislature could take. Legislators have introduced bipartisan bills that would hold polluters accountable to pay for the treatment of PFAS impacted drinking water. We would love to see those bills pass. Fire stations are going to need more funding to get rid of all of their old PFAS foams. The state could also do much more to proactively phase out the use of PFAS containing firefighting foams, as well as phasing PFAS out of their turnout gear that contains just astronomical levels of PFAS. Other states have banned PFAS foams for emergencies as well as for training drills and are requiring companies to disclose PFAS in turnout gear. Even the military is transitioning away from PFAS firefighting foam, but there are no restrictions on PFAS containing foam in North Carolina yet. We also think that the legislature could do much more to work toward ending forever chemical pollution in our air and water. There are many approaches for this that they could take. Some states have banned PFAS in specific products to discourage manufacturers from using or creating PFAS in the first place. North Carolina could also take action to limit polluters' ability to discharge PFAS into the air and water. I'd like to very briefly cover some actions from the North Carolina Department of Environmental Quality. DEQ is the leading state agency to protect North Carolina's natural resources. Due to actions by impacted community members and North Carolina organizations, DEQ has taken steps to hold Chemours accountable. Thanks to legal action from Cape Fear River Watch and Southern Environmental Law Center, the state has ordered Chemours to capture all PFAS processed wastewater, reduce air emissions by 99.99% of certain PFAS, and reduce groundwater levels of PFAS. Chemours now also has to sample and replace drinking water supplies for those with contaminated wells. These actions were taken under a consent order with Chemours. I want to really express the advocates see the requirements under the consent order as the floor and not the ceiling for what Chemours should do. And much more remains to be done to protect the community from Chemours. And we believe that DEQ and the state legislature both have roles in doing this. Going forward, we would also like to see DEQ take similar steps in going after other polluters in North Carolina. There are other industrial sites that are likely polluting our water and air with PFAS. The state has authority to stop PFAS pollution in the water. This year, we expect DEQ to propose rulemaking that will make it more difficult for polluters to release a subset of PFAS chemicals in our water. We expect there to be a comment period and public hearing later this year, and we'll be generating support to encourage strong rulemaking. Another piece to this story in North Carolina is the North Carolina Department of Health and Human Services Fish Consumption Advisory. Last summer, they issued a very stringent fish advisory that covers a large portion of the Cape Fear River and basically amounts to eating little to no fish from the Cape Fear River. We're expecting more data soon that will tell us more about fish further downstream in the brackish waters, and that could make a big impact because that's an important economic resource in the state as well. I wanted to note this issue to you all because of the strong health and also justice links around fish consumption. Unfortunately, the state does not currently have funding to test other rivers, so we don't know if the fish are safe to eat in other contaminated areas such as the Haw River. This is something Conservation Network and our partners are watching very closely this year. Emily touched really briefly on EPA, and I will be brief as well. I wanted to touch base on federal actions because there's so much happening, but there's 3 rulemakings in process right now through EPA. They're all a little bit in the weeds, and I don't want to get too lost in the details here, but big picture, if finalized, these rules, these 3 different rulemakings will give us more tools in North Carolina to protect folks from PFAS. If all the ongoing proposals were to be finalized as EPA has proposed, North Carolina will have tools to require drinking water utilities to treat for certain PFAS. We'll also have better authority around how some PFAS chemicals are handled at industrial sites as well as contaminated sites. The EPA is doing a lot, but I want to note that we still have a long way to go here. All of these actions are for a handful of chemicals out of the thousands of PFAS that make up the class. So like Emily already said, to get ahead of this problem, we need to keep encouraging EPA as well as state decision makers to move to a class-based approach. And in other words, handle all PFAS as a group so that we're not playing whack-a-mole with thousands of chemicals. So as you can see, there is a lot going on. This is a hot topic with decision makers, but we need to really keep decision makers on the right track to truly protect communities. And we really could use health voices in this fight with us. I want to start with a few examples of how you can reach your decision makers with a particular focus on state legislators. You'll see this link here if you need to figure out who your state or federal lawmakers are. This link is very helpful. So some ways of reaching legislators, of course, email can make an impact, especially a well-crafted email, but more personal outreach is always better. Calling is another simple step. You likely won't talk to a legislator when you call their line, but you can have a conversation with their legislative assistant or leave them a voicemail. I always recommend to express your concern on the topic, but also ask them to call you back. It will take them a little while to get back to you, and you may want to send them a quick email as well. I've found that to be useful. But definitely let them know that you want to talk with them. You can also request a meeting to sit down with legislators in their home district in your hometown. This is a really great time of year for that because legislators aren't in Raleigh, they're in their home districts and they have more bandwidth for discussions with stakeholders. I really want to encourage this because it can be one of the most impactful ways to build a relationship with a decision maker. And in some cases, depending on the legislator and location, we could also even help pair you with an advocate to go with you or to help prepare you. Once a short legislative session begins, you can also meet your legislators in Raleigh. Things move really fast in Raleigh, and you need to be flexible and keep in mind that legislators will have limited attention during the legislative session. But this can be a really fantastic tactic when there is a specific bill or policy request for a legislator. I also want to encourage folks to follow your decision makers on social media and sign up for email lists and pay particular attention to opportunities to attend town halls or candidate forums. This is a really great way to making an impact. Asking a legislator a question in a public forum on an issue you care about, like PFAS, is very effective. It's a great way to get an issue on their radar. And the question can be simple, just stating your profession and concern and asking them what they plan to do on PFAS in 2024. This can really go a long way to bring an issue to their attention. Just some basic advice on messaging. If I can express anything to you today, I just want to say that you don't need to be a policy expert on PFAS to make an impact on this issue. Health professionals can make a big impact simply by sharing your concerns for the health of your patients and North Carolinians overall. If you're hearing from concerned community members or dealing with PFAS impacted patients, please tell them. They don't always hear how regular people are impacted. All that said, you can also lean on the advocacy community for preparation. I'm happy to help brief folks that do want more detailed information and can also give insight as to where various decision makers might be on the issue and where you might be able to make the biggest impact. But I never want nuanced policy details to get in the way of concerned individuals speaking up for better protections from PFAS. This year, we also expect to have a few opportunities for public comment. This could be through the environmental agency's rulemaking, or the legislature could hold a hearing on a bill. And we always need voices of authority that are willing to attend those and speak out. So I think that's another really important role for health voices in this work. So if this all speaks to you and you're willing to be a voice for PFAS protection, either behind the scenes or more publicly, please feel free to reach out if you'd like to connect and kind of game plan how you can make an impact. And I can make sure you've got the information you need to feel comfortable speaking out on this issue. Lastly, I want to encourage everyone to follow organizations working in this fight. Clean Cape Fear and North Carolina Conservation Network are both working hard on this at all levels of government and run frequent email action alerts on the issue. You may also want to look out for your local Riverkeeper organization. There are many groups in North Carolina working on PFAS, and oftentimes advocacy organizations are one of the best ways to stay updated. So thank you so much for joining today, and I'm happy to answer questions later on.
Thank you so much, Stephanie, and thank you for sharing too how healthcare providers and nurses can engage on this issue. Now we're going to turn it over to Dr. Katie Huffling. Dr. Huffling is a certified nurse midwife and is the executive director of the Alliance of Nurses for Healthy Environments and works with nurses and national nursing organizations on a variety of environmental health issues, including climate change, chemical policy, inclusion of environmental health into nursing education, and sustainable health care. Ms. Huffling has written numerous peer-reviewed articles on environmental health issues and was an editor of the recently released Environmental Health e-textbook, Environmental Health and Nursing, which won the 2017 AJN Book of the Year Award in Environmental Health. Turning it over to you, Katie.
Thanks, Sarah. And so great to see so many people on this call. It's really awesome and is such an important area for nursing engagement. So as Emily was talking about, we have the new National Academy of Sciences, Engineering, and Medicine, PFAS guidance, as well as ATSDR. And when the NASM guidance came out, as Emily was saying, it is a huge document. And we quickly realized that it's just not as useful for providers on the ground, other health professionals. And so we were lucky enough to receive some funding to create this toolkit for health professionals so that you have quick and easy resources with patients potentially been exposed to PFAS. If you don't know anything about the Alliance of Nurses for Healthy Environments, here's our website. We're free to join. And our Policy and Advocacy Forum is doing a lot of work on PFAS right now. And so I'd highly recommend signing up for that. So you'll get updates in both state and federal opportunities for advocacy. We'd love to have you join us. So our toolkit, let me just move this. I'm on a different computer today and it is hard to see things. There we go. So this toolkit, you can download it for free on our website. It provides guidance on how to assess for exposures, how to test for exposures, and then also gives you guidance around advocacy, because we really felt like so much of the issues with PFAS is around exposures that really need to be addressed at a more higher level policy level, as opposed to looking at individual exposures. And so we have a couple of fun things on here. We're trying these out. So if you can go to this menti.com or use this QR code, we've got a couple of fun questions to see what folks are thinking about PFAS from our presentations today. I'm just going to stop sharing for a second here. Switch to. And we can see in real time as folks are answering the questions. Awesome. Yeah, and I would agree too. There are so many different, environmental issues. It can be really challenging to figure out which ones to prioritize. But I do think right now is a really important time related to PFAS, because it's in the public eye so clearly right now that we really need to jump on this to ensure that we can get the strongest protections possible.
To get a comment credit.
Because we do find out with, other environmental health issues, it's the cool new thing that comes out that gets everyone's attention. So we really need to jump on this while it's in the minds of legislators and policymakers. And so what are the things that you as health professionals can do? We can talk to our patients and communities. We can do clinical testing, which right now is blood tests. We can interpret those laboratory results. We have guidance now because of the NASM report on clinical management. And then what do we need to do for clinical follow-up? And I think that's probably one of the most important pieces related to PFAS exposures is making sure that we're following up over time and really ensuring that folks are getting the appropriate management over the long term. I think one of the most difficult things as a health professional is there's a lot of uncertainty around what the specific health impacts are related to PFAS. As you've heard earlier, there are thousands of PFAS chemicals, and we don't know exactly which chemicals cause which health issues. And so I think it's important to be honest with your patients to say that there is some uncertainty, but here is what we know. And giving them an opportunity to express their concerns. And it may be a discussion that needs to happen over several visits or, when they come in for yearly checkups to be talking about this. But I think patients are, they're very open when you're able to describe that there is uncertainty. I feel like it creates distrust if you try to say that you know exactly what's going on or that all of these things are definitive answers. So for our second question, just go to the same menti.com. Let me stop sharing and I'll move it to the second question. We had a really awesome intern who created these for us. She's moving us into the 21st century. So for folks that are clinically seeing patients, how many of you have had your patients ask you about PFAS? So when the NASM was writing the report, I had the opportunity to participate in some of their webinars and calls, and it was very interesting to have, especially primary care providers coming on those calls and saying how they did have patients coming in, but they had no idea what to do with these patients. They didn't know what tests to run, what kind of guidance to give. And I do think it's something that we're going to be seeing more and more of as it is increasing in the public consciousness. One thing that we felt was really important to include in our toolkit is this assessment questionnaire. In the NASM report, they really don't have specific questions to ask your patients to determine if they're at high risk of exposure. And so we adapted this exposure questionnaire from the CDC that they've been using for a number of years to determine exposures. Folks are free to use this. It's easy to print out. And I think it'd be super easy to include in a electronic health record as well. For clinical testing, there is no standard method for biomonitoring. In our toolkit, we list the different labs that are doing PFAS testing, as well as the codes that you need to use to order those tests. And this just lists who is at highest risk for PFAS exposure. I know someone had asked about the cost of these tests. They are still fairly high. So I do think it's important to do an exposure assessment prior to ordering these tests. They are probably not covered by insurance, but I think that is something as health professionals that we need to be pushing our insurance providers to be covering these tests. And as I stated earlier, our biggest thing that we really need to be working on is preventing exposures from even happening in the first place. And so there's a number of ways as health professionals that we can be supporting prevention. So working for ways to reduce PFAS exposures in the workplace. recognizing if there's PFAS water contamination in your area and talking with your patients about water filtration. We also have that in our report. Being aware of fish advisories, such as they have in North Carolina, and talking about how to reduce the use of products that contain PFAS. This includes things like Teflon, stain-resistant, water-resistant fabrics, some types of food containers, and we have a really great list in our toolkit that would even be easy to print out and give to patients. We have a couple more slides here with questions for you. So if you can go back to menti.com.
And Katie, I just wanted to bring up that some folks were saying just they needed just a little bit more time to get to those Menti questions. So
Oh, let me go back. Sorry, 'cause I can't see any of the, I can't see the chat, so. And I know we're almost running out of time, so I think I might make this the last Menti question, even though we're, there's a couple more in there. I want to give folks enough time to we can come back to this. I'm worried about time here.
Okay, well, while we're doing that, we have had some questions in the chat. I have put the link to the PFAS toolkit in the chat, along with the National Academies of Science, Engineering, and Medicine, and the updated ATSDR guidance. I'm going to let which of our speakers want to answer these questions. The first question was, what testing is ordered by the primary care provider and the cost? And is this paid for by insurance? Dr. Huffling, I think you talked a little bit about this in your presentation, but did you want to add any additional information to that?
Yeah, again, it's in our toolkit, we have a list of all the different labs. There's about, I think, 8 labs that do offer PFAS testing, but I think it's important to note that they only have testing for a handful of PFAS chemicals. So you're not getting the full picture of potential exposure. So I think that's important to note. I believe the testing can run anywhere from $700 to $1,000 on average. And again, I think that we need to really be pushing for insurance companies, or in areas where you have confirmed water contamination or contamination from other industries, those industries really need to be stepping up and paying for testing for folks.
Thank you. And Stephanie, I'm going to direct this one question to you because you talked about the some of the regulations that are coming up. We had a few questions talking about when did waterworks start screening and filtering for PFAS, and what type of when will water treatment facilities be expected to be filtering out PFAS? And I think you talked a little bit in your presentation about when we could start to see some of those things if the current proposals go into effect.
Yeah, so I will do my best to answer that question because it is a bit location dependent. So some of the Cape Fear utilities have been testing now for a few years and have put in very good water treatment processes. They're still learning. They're just recently we learned that there were some breakthroughs at the Cape Fear Public Utility Authority. So they're still learning around that. EPA any day now should be issuing final drinking water standards for a subset of PFAS chemicals. The proposal that we saw, we hope that that is what is finalized. Gen X is included in that proposal, and that's incredibly important that that's included in the final rule for North Carolina, since we have so much Gen X in our state. Through that, North Carolina, our environmental agency has been testing major drinking water providers and all of the major utilities. Not all of that data is public yet, but it's constantly coming down the line. So folks should be able to get, in North Carolina, you can get some pretty good information by visiting DEQ's website. You can also go to your drinking water sources site and you might find information there, but right now they're not required to put anything on that site. So it's kind of hit or miss. But I'm also happy if folks have specific questions about specific locations, I can try to help with that. Emily, I don't know if you want to add anything to that.
Yeah, so the EPA also does an unmonitored contaminant report called a UCMR, and we're on the 5th cycle now, and they've expanded the amount of PFAS. And so utilities all across the nation, public water utilities, have been required to do those tests, and they're starting to send their results in. And so I think we're finding other areas across the country where there may be PFAS. To Stephanie's point, if the current proposed drinking water standards are finalized, there would be a grace period of like 1 or 2 years for utilities to make sure that they are testing and treating for those 6 PFAS to address them and get into compliance. So it's not going to be this shock to the system. I think it's also important to point out that billions of dollars were given to utilities across the nation in preparation for this, because this is the first time drinking water standards have been changed in decades, which is a sad reality for the American drinking water systems, is that we definitely are behind on addressing water contamination.
Thank you both so much. I'm going to stop recording right now, and the